Okay, welcome to the Voice of San Diego at Home. My name is Scott Lewis. I'm the editor-in-chief and CEO at Voice of San Diego. We have got a great show today. We're going to be talking to Dr. Rebecca Fielding Miller, who is going to school us on epidemiology and the latest. You might remember we had her a couple months ago on the show. I don't remember. It must have been a year ago, 6 months ago. Time means nothing. But we had her on. We're going to get an update from her. She has some new observations and new insights, and hopefully can give us a picture of where things at. Again, it is June 29th, 2020. We are careening through this overlapping crises period of American and world history. And thank you for being with me as we have gone through that. Let's go through a couple of updates, though. We talked... today's going to be about the County of San Diego. So just some background, the County of San Diego has 5 supervisors. There are 5 members of the Board of Supervisors. They represent different parts of the county. And this weekend, or I guess it was Friday, Supervisor Jim Desmond gave an update from his own perch at the county. He represents the northern part of the county and northeast part of the county. There's a northern coastal representative, Kristen Gaspar. They're often united on some of these issues around the pandemic. Here was Supervisor Jim Desmond on Friday, sort of trying to put in perspective in his own way what was going on with the crisis in the public health and the virus.
And the good news is, even though we're doubling up in the number of testing, our hospital usage has only gone up about 10%. If the correlation was the same, double the testing, double the amount of hot people in the hospitals, there'd be a lot more to worry about. So right now, the hysteria does not follow the numbers.
Okay, let's talk about the hysteria for a second. So he was talking about this vast increase in the testing, and we are testing a lot more people than we were. But one of the things that he said that hospitalizations have not grown proportionally. But that very same day that he said that, the county came out with an update to its triggers. You can go to the triggers page and follow. This are the triggers that he and everybody else on the Board of Supervisors set in place to sort of make sure we were on track with this reopening. If we can continue to reopen, but these would be the triggers. These would be the canaries in the mine that would let us know if we were going to be in trouble, if we needed to roll back or do something else. Now, if you look at the triggers there, on the left is community outbreaks. That has since been triggered again. It was above that sort of 7 new outbreaks total before that. It took 1 day off from that, and it is back. It is back. It is now triggered. And then this increased hospitalizations. This says hospitalizations can't go up more than 10%. They are up 19%. So he makes this big thing that hospitalizations are only up 10% or whatever. And then he later in the video says they're down, or they're not going up. They are not going up. They have gone up, and that has triggered this other part. So we are now watching hospitalizations. I think you can call that soar. They're above 400 for the first time in many, many weeks, and they keep going up, 12, 15 a day. And so the rise in cases, along with the rise in hospitalizations, is causing some worry. He did say he's dealing with a lot of stress, a lot of frustration, and he tried to make a point about what he's doing to deal with that. I'm not making this up.
Well, I'll tell you. This is how I dealt with it this week. I went to North County Shooting Center in San Marcos, and they have this great target here. It's the COVID target. So as you can tell, I'm not a dead-eye shot, but I got most of these COVIDs, put them out of their misery, and hopefully this is how I relieved my frustrations.
Just when in doubt, shoot it. Your firearm. What a moment in history. You can also check out the politics report I did this weekend. I covered the East County race for supervisor. There are 2 Republicans running in that district. The future of the county is in the balance right now. Kristen Gaspar is running for re-election in that sort of north coastal district, and she's running against Tara Lawson-Remer, a Democrat. The winner of that race will really shift the balance of power on the County Board of Supervisors. It could be either very much more left than it is now or much more right, but also it doesn't really break down that cleanly in some of these. So watch all of the future of the county supervisor races. Now, I want to bring on my guest, Dr. Rebecca Fielding Miller. Hello, doctor. How are you?
I'm I don't even know. I'm doing my best.
That's enough. We're good. Yeah, we're all in that same. I don't know. There's some good things and some real bad things, and it's hard. Thank you for taking the time. We have already a ton of questions here. We're going to go through a few of them. But I wanted to ask you about something you wrote. You had a post on Facebook, went mildly viral, maybe just straight viral. You're a doctor of infection, or you study infectious diseases. You can tell me if it was viral or not. You said this, quote, "There is blood on the hands of every politician who voted to reopen." And I think you would include Supervisor Desmond with that. Tell me what you're talking about with that. What have you seen with the numbers?
Yeah, so I'm waiting for my university media folks to come for me on that one. So I wrote that quickly in my break between bath time and story time for the smallest person in my house. But I think it's been something that I have been seeing and been deeply frustrated with for months. It is not a mystery. There is not a lack of evidence on how we should deal with this. Nearly every other industrialized, wealthy country in the world has enacted a similar strategy, and it has worked. And it has been really frustrating to watch politicians all over the country and in our region vote in ways that are contrary to what the evidence tells us, especially when the evidence tells us that if you do this thing, people will die. So I was frustrated, and I don't know what else to call that.
So we talked to you again, I don't remember, it was a while ago. And we really focused a lot about how to live life in what was then a pretty strong quarantine. There was none of these bars and restaurants open. I don't know if the beaches had opened then yet. I don't think so. We were waiting to see if that would happen. We were talking about the outdoors and how much promise that had for living life with a relative comfort of the threat of the virus. Now it's almost July. Where are you at with your lifestyle now? Are you have a toddler?
Mm-hmm.
You were doing some home care options with somebody who could help you at the house.
Mm-hmm.
Where are you at now, and how are you analyzing the risks?
Yeah, so we still have a babysitter coming because we have to work. I have recently, I have one grocery store that I feel good about going to, and I go grocery shopping for everybody once a week. You can't buy beer there, so I just bought 5 gallons worth of homebrew kit to make it back
there we go.
to the house. So if that tells you where I am, I'm just brewing my own beer and making my own sourdough and hunkering down.
Yeah. There's something fascinating about all the puppies and the baking of the bread. My wife's been brewing kombucha. Like there's something, we're all like just nesting or just taking care of ourselves. All right. So there are a ton of questions. People, if you're out there, if you have a question for Dr. Fielding Miller, let us know. Put that in the comments. I've got some on Twitter. I'm going to poll too. We're broadcasting on Twitter, YouTube, and Facebook. So put in your questions for this expert on infectious diseases. She really built her career studying HIV. And I think one of the greatest insights I got from you back then was, know your status. We needed to be able to spread testing. We really improved how many people are getting tested. But unlike other countries or places, we're not able to scale that out to other things like schools. We haven't been able to figure out like if we could test educators. Well, basically they've just punted that's even an option. UCSD, I know, has had a pretty ambitious plan to test and trace and allow people to go back. What have you heard about that? Are you guys going back like planned, or is that still in jeopardy?
Yeah, so UCSD, we're we're pretty lucky. We're really privileged in that we have a really strong health system infrastructure behind us. We have a school of medicine that's been sort of treating COVID patients since the beginning. And so we have the capacity to do enough in-house testing to hopefully test everybody who wants to be on campus at least once a month. So we're working with faculty and students and staff to get a sense of what we can do that would make people feel safe and how we can implement our resources in a way that serves our community. So we are very lucky to have that, but I know not every university has a massive medical system at its back.
All right. What are your questions about schools? What are your questions about the disease, about how viruses spread and what things are like exponential spread are and stuff? She is an expert on that. Let's get into it. First question came in. I wanted to talk about, get on Twitter. One of the questions that came in was schools reopening. Some parents are being asked to choose between full distance ed or have kids attend in person. It seems like all the school districts are basically coming down to that. They're going to allow for an online option or for kids to go to school with all kinds of modifications. What have you learned since we last talked about children, and about what would your comfort level be as a parent, and knowing that parents desperately need these little people to leave to get out?
I know. It's so cute and so loud. Yeah, you know, it is deeply frustrating not to have the data to be able to make good recommendations. I think one thing we're starting to see is it looks like kids might be a little bit less likely to get sick in general, and they might, it's not just that they're asymptomatic, it looks like they might be a little bit less likely to become infected. Although possibly not by much. And it looks like kids might be a little bit less likely to be infectious. So there was a justice study done in San Francisco that I've been waiting for, where they tested literally everybody in an area of the Mission District. They found enormous health disparities. Latino folks were 28 times more likely to be positive, but they only found about 3%. They found about 3 to 4% prevalence in everybody, including kids. But there was another study out of Iceland where they did kind of a cool thing where they looked at, you can look at the different viruses and see who gave it to who. And it looks like infection from kids to adults is a lot less likely than adults to kids. So there is so much conflicting information out there. My sense is the younger kids are, the probably safer it is for them to be in groups. And possibly they are less likely to spread to adults, although that's all over the place. I will be sending my kid back to daycare the day it opens, in the hopes that they spend most of their time outside. I think for older kids, it's just as much of the day as you can spend outside, you need to.
Yeah, we talked about outside last time as a real important option. If kids are together, summer camp should all be outside, that kind of thing. There was some recommendations that came down from, we had a couple of comments about these modifications in the schools. There was a determination in San Diego Unified that they would wear masks. But then I asked one of the student reps on the board whether that was true, and he said his interpretation was that they wouldn't be required. How big of a deal is the mask in a setting like a school? Is if we go to a high school this fall and all the cool kids have made it so that nobody's wearing masks except for, maybe 10% of the kids, are you going to look at that and say, like, that is a massive public health problem right there? And what would that mean if so?
Yeah, so I think you can look at it as sort of a package of options, and the more you can use, the better. So obviously distancing, this would be a great time to go 10 to 1 in every classroom. And being outside, and I think masks are a part of a strong package to keep kids and the adults in their households safe. So if I were in charge, I would recommend that especially older kids, middle school, high school, wear masks. Younger ones, I know it's hard. It does look like visors might have similar efficacy in smaller kids. I just bought my kid a little bucket hat with a plastic visor. She looks like an adorable beekeeper. So that's one option.
There's garbage truck going by. I was trying to mute. Sorry. Life at home is hilarious. So you had this, I think your broader point was that we reopened too fast and that we put people at risk, and there will be people who die or suffer more than needed to because of that. At what line do you think that happened? Do you think the entire effort to open, like from beaches to parks, or literally like, or just, some point, with dining and bars? One thing I've come to understand, it feels like once they did dining and bars in particular, I think that sent a message that it's okay to do what you do at bars, which is party, which was, and once you send that message, like, it's really hard to be telling everybody they're still in quarantine or that they're still, need to watch out for this. Do you think there was a line that was crossed in the reopening?
I think that, if you look at many other countries, if you look at Italy, if you look at Germany, if you look at China, if you look at South Korea, there was not a move to allow people to congregate in small spaces until cases were very much under control. And I think bars and gyms in particular give me a little bit of a nightmare, because those are places where people aren't wearing masks, are breathing heavily indoors, are yelling indoors for any number of reasons. I find bars and gyms particularly problematic. But I think the other thing is we did give ourselves some time. There was probably about 4 to 6 weeks where just kind of everybody was doing it and we all stayed home and it was great. And my deep frustration is that we didn't really ramp up testing and contact tracing in that time that we bought ourselves. And if we had done that, if we knew that anybody could get a test as easily as they could get a cup of coffee or their beverage of choice, if we knew that contact tracing was rapid, that there was rapid testing turnaround, then I think it would be a very different story. Then we would be in a place of containment. But as it is, we were just trying to mitigate the ICU impact. We stopped doing the things that would mitigate the ICU impact, and now hospitalization numbers are going up again.
Mm-hmm. What do you think is the most important number that the county is putting out right now? Is it that positive rate that we were talking about before? It seems to have gone back up really fast, but they say it's only 14-day average that we need to look at. Is it the hospitalizations? That seems like our main thing, idea of protecting the hospital's ability to take care of people. What's the first number you look at?
Yeah, so when I'm doing sort of peer-reviewed, what is the effect of X on Y stuff, I look at death, because that's harder to, it's more clear what happened, right? That's not useful for in-the-moment decision-making, because there's a 3 to 5 week lag. You're learning what happened 6 weeks ago. I think right now some of the most useful numbers might be hospitalization. ER visits are probably so-so, because I think a lot of people are avoiding the ERs because they're worried about COVID-19, and that's causing a lot of other problems. The positive test rate I think is important to look at, but as we expand the pool of who's testing, and in particular, since testing is a lot more accessible in places where it is needed less, since it is easier to get a test in North County, where people are more likely to be negative, and harder to get a test in South County, where people are more likely to be positive. If anything, I think those positive testing numbers are low, because they're kind of being diluted, so to speak. Hospitalization now, death in 6 weeks.
Mm-hmm. Does it give you any hope that the hospitalization numbers aren't, and the deaths aren't necessarily tracking the positives in the same way? Or is it such a lagging indicator that you fully expect it to catch up and have that same curve?
Well, I'm looking at data right now on hospitalization. I pulled up a little graph from San Diego County, and it looks like, hospitalizations have started to climb enormously since the 21st, on almost the exact same slope as cases. Mm-hmm. So yeah, I mean, looking at the data doesn't make me feel comfortable that this has gone away. It just confirms that if people start going out again, more people are going to get sick.
Yeah. Yeah. All right, let's look at some of these questions. I just want to deal with, he's brought it up a couple times. I have a health question. I wanted to know if someone who has never had chicken pox, what's the likelihood of them getting the COVID virus? They're not related at all, correct?
I don't think so. You know, I'm not a
Yeah.
clinician.
Right.
I would guess it's no association, but honestly, we are still learning so much about what this virus does that it's hard to say. And I think if you have specific questions about your own risk, it's really good to have a televisit with your doctor.
Right, right. Somebody brought up, I'm not desperate to get my kids out. I just want them to say, I agree. I didn't mean to make light of that. Sorry. I'm desperate for them to have a good education, and I'm worried about it. The way things ended last year weren't so great, and I'm hoping for something better. Let's see, another one. We had a question come in from Rachel. Said, what are you and other medical experts doing to keep yourselves and your family safe? We talked about some of the things you're doing you're hunkering down. What are you, would you be willing right now? I asked you this a few months ago. Would you be willing to go out to a beach and sit near friends?
Yeah, so we do go to the beach because it's outdoors. There's a strong breeze, especially because you're on the coast. I have been going to the beach even with friends who we don't live with, and I feel pretty reasonable about that. I feel okay about sort of socializing with people from a 6-foot distance outside. You know, the thing I want to say about schools too is I love my kid. She's very cute. She's very damp. It's not just that we want our children out of our house because they're driving us crazy.
Right.
I think, and the American Academy of Pediatrics, somebody pointed out in the messages, has recommended that kids go back to school because schools provide so many services beyond just education. And one of the things that I'm really concerned about with schools not reopening is there's going to be this vast acceleration, not just in racial health disparities, but racial, social, and educational disparities as well. Kids aren't going to be getting meals. They're not going to be getting services. They're not going to be getting check-ins. And wealthier parents are going to be able to sort of make up for that, and less affluent parents won't. And I think there's going to be really long-term effects from that.
Yeah. Yeah. I mean, I think that's part of what we're dealing with. One of the things I read today, I'm going to share the screen real quick, and I encourage you to look at it. There's another group of people I don't think we talk about enough. This is from sdnews.com, and it was the story of a woman from her own perspective about what she's been dealing with in a retirement community. She said, I spent time in our gym. Before all this, I had a personal trainer. I had an assistant come. We were allowed to go to the movies. We had dinners. We had lectures. We had concerts. I complained I was too busy. I clocked 10,000 steps. And then the pandemic struck, and now she's, I don't want to say prison because I don't want to make light of that. Obviously, it's not prison, but it was kind of I really had trouble reading that because the life that she had, has been completely taken away. And I don't know when that ends, like for her or for anybody. Could be years before somebody like that should feel comfortable going out in the community. And I think that's what gets back to this question of what if you were to try to lead a group that was creating a manual for how we can live, balancing the idea that we need life still, like you said, but we also need to protect people. We don't want to have, like you said, blood on our hands. What would you start with? Are there some core principles we could point to? Like, for instance, what if we just said, just don't go indoors with a bunch of other people?
Yeah.
Like, don't go to a funeral inside, or don't go to a party inside. But maybe other things are okay. I don't know.
So when I think about how we can keep people safe and healthy, and especially how we can do it in a way that doesn't exacerbate health disparities along racial or economic lines, I think about sort of some different levels. So I think about what we can do as individuals, but I also think about what we can do as a society, right? So at the individual level, yeah, there's all that stuff. Wear a mask, socialize outdoors, 6 feet away from one another, go to the grocery store as little as you can, all of these kind of individual level things. But I think there's also a lot of social level things that are important, and that includes access, consistent access to rapid testing with strong turnaround. That includes a contact tracing system that is considered acceptable by communities that are a little bit nervous about the idea of more government surveillance because they have a long bad history with that. And I think that that is just as important to keeping all of us safe and healthy as these individual factors. And I think that, for example, it's connected, right? So schools can't open in a context with an out of control pandemic. They just can't. So all of these things are interconnected.
You've brought this up a lot, and I think this concept of know your status, which we pulled from the HIV experience, that it wasn't enough to say don't have intercourse with other people, don't have sexual relations with other people. Obviously, humans are humans. We had to do something different, and that was education and know your status. How realistic is it to imagine a world where a COVID test is accessible and affordable and scaled out to the point where, like HIV, you could know right away if you have it, and you could know your status and your network status? Is that like a pipe dream? Because I keep bringing it up, and people act like it's impossible for us to even imagine something like that enabling life at schools or life to resume in a better way.
Yeah. So I am not. I don't create those tests, but to me, my sense is that is a lot easier and more feasible than a vaccine, frankly. So that's something, I mean, we have that for HIV. There's a 30-second test. They're very cheap. They're everywhere. I could foresee a world where you take your test in the morning and you plan your day along those lines. You ask everybody to take their test before they go take the SATs if those aren't canceled, that type of thing. And I would feel pretty comfortable in a world like that, assuming other people were also using it.
Yeah. That's what I kind of get to with the masks too, is they protect your face, they protect you from touching, they protect you from, droplets that you spread out, and protect other people from those things. But they also send a signal to the rest of the country or the world that you are doing what you can to contain this. You're part of that agreement, that social contract we've all made with each other. Like, we're going to do our part. And when you see somebody who refuses to wear a mask, what they're saying is, I'm not on board with that. So there might be a bunch of other things that they're not on board with. So even if we had a testing regime, what you're saying is, like, you could have a bunch of people like that who aren't playing along, and thus make it harder for everybody to sort of resume. Because to me, the mask represents like a willingness to go out into the world and to butt heads with the world, to be out. And it's not a weakness to me. It's a difference. And I guess that's kind of what you're getting at with this idea of, like, you'd want to know that people were on board with it.
Yeah, I think we don't always think about how deeply connected everybody is, right? And I think especially in Southern California, that's really easy because we all have our cars. Well, most of us have cars and we drive around, and we live very sort of atomized lives in a lot of ways. But we are so deeply interconnected. And so, and an airborne-ish virus makes that really clear, that, you're not safe in North County until people are safe in Otay Mesa, right? Everybody is connected, and you have to act like it.
All right, let's turn to another question. I think you might know this person, Katie Fielding Miller.
That's my mom.
Okay. What can we learn from a blood test versus a cheek swab? I know you don't have necessarily a lot of specific medical credentials, but what would you say to that?
Hi, Mom. So, so I think, just because she texted me about this earlier, I think she's referring to the antibody test, the serology test.
Yeah.
And so what that can more or less tell you is if it looks like you've had a coronavirus in the past, and probably the COVID-19 virus. There's about 5 coronaviruses in that family that kind of circulate. Most of them just cause a cold. So if you get a positive test from that, it means you probably had COVID-19, but it could also mean that you've run into one of those other viruses, and it's not really clear if it's telling you if your body sort of mounted a full immune response or you were just kind of close enough to get annoyed by it. And we're also seeing that it's really unclear how long, if you do have immunity, how long that'll last. So initially, we thought maybe 4 to 5 years based on how other coronaviruses behaved. Now there's some studies emerging suggesting it's more like 2 to 3 months. So I think it's an interesting novelty, but I think frequent active virus PCR, the nasal swab testing, is probably more immediately useful.
Cool. Yeah. Let's take another question. So this one you addressed earlier. I just wonder if you could go into it a little bit more. This is from Paige. She says, can you clarify data on the risk to children and whether or not they spread the virus? Can you elaborate on what you have heard about that? I've heard from people that say, like, look, it's obvious they've proven that kids don't spread it. They've not done something that certain, right?
Yeah, that's really the $1 million question. So I think we know that asymptomatic people can spread the virus. Obviously, if you are coughing and sneezing, you are kind of emitting more virus than if you weren't. So if you're symptomatic, you just sort of mechanically can spread the virus more. Since kids are more likely to be asymptomatic, it seems as if kids maybe get sick as much, maybe a little bit less, but maybe they're less likely to be symptomatic. So mechanically, they might be coughing and sneezing less. The flip side of that is, they're damp and they put a lot of things in their mouth. I'm talking the smallest ones. It's such a good question, and I feel like this is such an important place where the science really needs to be moving along right now, because we don't know, and the information is changing every day. My sense of things, again, is child to adult transmission is probably rarer than adult to child transmission. And there's probably an inverse-ish relationship between how able you are to behaviorally keep yourself under control. So like how well you can cover your mouth when you cough, keep away from people, and how likely you are to infect people. So little kids, really damp, but also maybe not that infectious. Older kids, maybe more infectious, but better able to stay away from people, I think, but we're still learning.
There was a question, I'm not sure if I can find it, about if you are immunocompromised and your child does go to school, what should you, A, should you even let them at that point? And B, should you, is there something you can do, just make sure that they keep their masks on, that sort of thing? Or is it just, it's just a risk you're going to really need to reconsider making?
Yeah, that's a hard question. That is something that I would have a conversation with my provider about. So one of the reasons that we're comfortable sending my daughter to daycare when it opens is my household has the ability to be a closed system. So any infection that does come into our house, we know it can stop with us, and my husband and I are comfortable with that level of risk for the two of us. I think I have heard sort of from the HIV literature that folks with HIV may not be at any higher risk, and I'm referencing that because they're immunocompromised. But again, I think there's just not enough data on this to be able to say for sure, and this is somewhere where I would probably be pretty cautious, which sucks is the technical term. Sucks.
Yeah. This is a good question, and I don't know what she's getting at, but I want to ask from it. What is herd immunity? Can you explain that concept to us? We've heard it a lot. I think I get it, but I'm sure you could explain it better than I can.
Yeah, so herd immunity is something that we talk about when we talk about vaccines. So, for example, the measles vaccine. Let's say 97% of people get the measles vaccine. And somebody goes on a trip to Disneyland and runs into somebody from Sweden and comes back to school and they get the measles. If 24 other kids in that classroom all have the measles vaccine, then it's going to stop with them and the measles isn't going to take off. But if only 20 kids in that classroom have the measles vaccine, and measles is incredibly contagious, then 2 kids are going to get the measles and they're going to spread it out, and they're going to spend 20% of the people they come in contact with, and it'll sort of explode. So if enough people have immunity, it's sort of like a wall with very few cracks in it. And so people talk about this idea of herd immunity with COVID-19, and I think that's what she was talking about. But the problem is, first of all, that will take a very long time. It looks like maybe somewhere between 5 to 6% of people in LA and San Francisco have had this so far. I think in New York, serology studies suggest maybe 15% of the population. So imagine doing this for 12 times, whatever. How long have we been doing this? Since January? 12 times 6 more months.
Forever.
Forever. We'd have to do this for 6 more years to reach a 97%. And that assumes that your immunity lasts forever, when potentially it only lasts for 3 months.
So here's what I had this discussion with somebody and I didn't understand the answer. Is the virus going to spread to a certain number of people no matter what? Or let's say without getting a vaccine,
Mm-hmm.
will it penetrate human society and human population to a certain point no matter what? Or will New Zealand be able to stay its little place and free of it until the other side, whenever that is? Like, is that even possible? It seems like that's a core question at the heart of so many of these discussions.
Mm-hmm.
Is, are we just putting off, this because we're trying to protect the hospital capacity, or can we literally keep a big group of people from ever getting it?
Mm-hmm. I do not think behaviorally, just because people are people, I do not think we can be in quarantine forever. However, I do know that all the steps that public health scientists are recommending, we're recommending because exactly that has happened, right? So the SARS outbreak, this is exactly what happened in Hong Kong. People went into lockdown. There was robust testing and contact tracing, and they literally managed to eliminate it just with those basics. This is how the Ebola outbreak has been dealt with every time it emerges, is you find out who has it, you quarantine them, and you find out who they've been around. So it can work. It's very, very hard to work when there's 400 to 4,000 cases a day. If we had used our time when the number of new cases was dropping to put those systems in place, then yeah, maybe we'd be safe to go around our day, but we didn't use that time very well, which makes me bananas.
That's what's so hard, is that this has been so hard. And if we just lost the chance to make progress during that period, what was the point? Here's another question from Bill. Dr. Fauci said this morning he'd be happy with a vaccine that was 70 to 75% effective. Do you agree? The measles vaccine is much more effective than that. What would effective rates matter?
Oh, that's such a good question. So we know the flu vaccine usually hovers around 60-ish% effectiveness. And we know that the flu vaccine is worth getting, especially this year. Please get your flu vaccine, because imagine a year when emergency rooms are overtaken with the flu and COVID-19. Please get a flu vaccine. So 75% effective means instead of 400 new cases a day, we have 100 new cases a day. That's great. And if we have 100 new cases a day, that is a lot easier to track down than 400 new cases a day. I will take anything. And and especially remember, when you think of it as a package of options, there's no one silver bullet. So people wear masks. There's a 50% effective vaccine. People stay outside as much as they can. There's rapid testing. That's a really good package.
Mm-hmm, mm-hmm. All right, I think I have her for a few more minutes, folks. If you have any last questions, please get them in, and I'm sure she'll follow up. This is Dr. Rebecca Fielding Miller, an expert on infectious diseases at UC San Diego. Do you imagine doing a lot more personal research into this, or is your focus, how is your personal focus and research going to change because of what's happening?
Yeah. So I find that I've been doing a lot more science communication than I used to.
Yeah.
And some of that is because I historically work in Southern Africa, and my Zulu was only so-so. But some of the work that I've been doing with colleagues is around sort of spatial determinants of health. So we looked at every county across the United States to see what counties had in common where more people were dying, for example. And we found that counties with more farm workers, counties with more non-English speakers, so immigrants, were seeing much higher rates of mortality. So I've been looking at things like drivers of health disparity, sort of county level issues. I've been partnering with some groups here in San Diego because, as I've mentioned, a lot of immigrant communities and minority communities are really nervous about contact tracing for really, really good reasons. And I think it's really important to work with those communities to hear what they have to say and to devise a strategy that they feel will be effective for them. Otherwise, it's not going to work.
That's a really interesting point I would like to explore just quickly. It seems like it was clear that at the beginning, wealthy people spread the virus into like ski resorts. They landed in places like La Jolla. It spread at first, and then it changed, and a lot of people who had to work through the quarantine ended up deeply affected. Meat packing plants, notorious places where people are working very hard, a lot of immigrant labor, and very close together in cold, tough places. And that disparity seems to only have gotten worse. It's like if you had the luxury to really isolate yourself, you could. And now the people who had to continue to, or did continue working or being together, are at risk. We're seeing meat packing plants. They're continuing to operate even after they've found some of these outbreaks. So you're trying to look at why that is and what can be done about it.
Yeah, so a lot of my research for this and also now is on what's called the social determinants of health. So I have always been really interested in how people at the furthest edges of society are always at the highest risk of poor health outcomes, poor social outcomes. And I have always been really interested in how you can partner with communities to create solutions that will work for them and are based on sort of the needs and perceptions of that community. And I think that's just as important here as it is in Southern Africa. One thing, I've been doing some reading, and I'm sorry to say I'm starting to feel more like Ebola is a better analog to this than HIV. And one thing that is really clear is when we were working to address the Ebola outbreak, first, the CDC, having kind of learned from some past errors, put out a call to return Peace Corps volunteers, who are legion in the CDC, because they have the skills to just sit and listen to people first. And second, that contact tracing efforts that were really community oriented, that worked with community leaders, that were run by kind of local NGOs that already had trust, they were a lot more successful, if a lot less efficient, than centralized efforts. And that was really key to getting things under control.
That's fascinating. All right. Well, I think that this brings up the question about Tijuana. There was another question at the very beginning. How reliable do you think the stats are from San Diego County? And especially, there's a lot of concern about the areas south of the border, about Tijuana. Here's another one that came in. Tijuana, Mexicali, Baja in general has had a lot of trouble with the virus, and we're part of it. We're part of the same area, like you said. No matter how separate we are politically, or we're interacted. It's part of our world. Do you have any insight about what either the credibility of the statistics or what's happening south of the border that we need to keep in mind?
I haven't been paying super close attention to what's happening in Tijuana. Obviously, I know that hospitals are really overwhelmed there. I would guess that, we are connected, and especially the very high rates along the border are probably to some degree, they would have to be in some degree connected to how much movement and interdependence there is among people on the border. But I think it's also really important to remember that those are the people who tend to have sort of the service jobs, the essential work jobs. That's where housing tends to be more crowded. That's where people tend to be more reliant on public transportation. So we're definitely affected by what's happening on the other side of the border. And people who live on this side of the border have so many more social risk factors too. So it's all kind of intertwined.
All right, I'll let you go after this one, but this is a good one. We're all going to leave this, and some of us are going to go watch the county's discussion and see the latest numbers from that. Mm-hmm. There's a chance they may stop some of the reopening or roll back some things. Your public health officer, Dr. Rebecca Fielding Miller, new public health officer, you have vast powers to deal with this. What do you do? Do you roll back some of these openings? Do you what kinds of other things would you do if you had that kind of influence right now?
Mm-hmm.
Would you close bars?
Oh yeah, no, bars are no. Nobody go to the bar. Just
don't go to the bar.
With your friend in a park. Just stop going to bars. Yeah, sure. I'd open container laws. Go have a beer with your friend in the park. I would 100% shut down any closed indoor place that people didn't need to be. I don't know that you need to be dining on patios either, right? The risk to that is just too high. Were I in charge, I would make sure that we have money allocated, those vast reserves the county has been sitting on for a while, to make sure that all the people who work in bars and restaurants are economically sound until we have a robust testing and contact tracing system in place. I would also immediately start reaching out to community-based organizations in City Heights, in Chula Vista, in South County, and talking to people about what those communities need to trust a contact tracing system. And then I would hire 1,000 contact tracers. So
okay, that was going to be my follow. That was going to be my follow-up. Is they have hired about 500 contact tracers. They claim to have done 14,000 investigations so far. That's not enough.
I mean, I think enough is when the numbers start going down, right?
Yeah, that's the theory, right? If you had contact tracers isolating people who were exposed to the disease, and if it was successfully working, then we wouldn't see the numbers go up.
Yeah. And it's one thing to, I believe the metric they're using right now for contact is we picked up the phone and dialed a number. It's not we got a hold of somebody. I don't believe it is. It's not somebody is now in isolation and economically and socially supported for 14 days. It's we dialed a phone number. So I'm not sure that that's a great measure of success.
Well, Dr. Rebecca Fielding Miller, I really appreciate your time. We have a lot of people who are worried about schools, we're worried about their futures, their jobs, worried about their lives, whether they're stuck in a senior's home or a community right now, or whether they're immunocompromised, or whether they just want to hang out with their friends again, or somebody died and they want to go to a funeral. Is there anything else you would tell them about what we know about infectious diseases and what we know about human history with them that may put some of this in perspective?
Yeah, it's not going to last forever. I do not think that. It is going to end. It's going to be another miserable, I don't know, a year and a half. But it's not going to last forever. People are resilient. And I think it's important to remember that we are all sort of massively together experiencing a shared trauma, and that messes with you. It messes with your sense of time. It messes with everything. But it will end, and someday your grandkids will be horrified that you had to live through 2020, and you'll get to tell weird stories about it. So, sorry.
No, I agree. Thank you so much. Any people can find you on Twitter, I think, at what's your tag there again?
RKF Miller.
RKF Miller. She's been doing some data visualizations. She's been getting good trouble, I would call it, getting some good trouble out there. Thank you so much for taking the time. And hopefully in 2 months, we'll bring you on to analyze just how great things have gone.
I'll tell you how all the numbers are going down, and it's fine.
All right. Thank you, Dr. Miller, or Dr. Fielding Miller, and we'll talk to you again soon.
Okay, thanks.
Yeah. Well, I always enjoy talking with her, and what a great resource to have that here and right at UC San Diego. They do great, important work. I just want to share that piece again, if you don't mind. Sorry, it kind of really got to me. This woman's story, Natasha Josephowitz, and her story about what it's like at her seniors community. A lot of people have made the point, like, we just need to, some people are just going to die from this, that they have underlying conditions or whatever. And it's just, what are we going to do? We have to live our lives. Well, that's the kind of person you're talking about. She has a lot of life. She's involved. She's obviously very lucid and interesting, and she's not expendable. And I hope that we think about people like that as we go through this, and make sure that we understand that there's a lot of life still to be had, and let's do the best for everyone, for the most people involved. And thank you for taking the time, and stay tuned. We got at Voice of San Diego doing a lot of investigative work on this, on the three crises, on the investigative front for schools, for the government crisis that everybody's dealing with as far as their finances, to questions of energy, to questions of trust with police unions and police departments, to all the issues with regard to what we're dealing with right now. This is your place, and please take a moment to understand it. If you have any questions about how it works, we have a two-part mission: to do investigative work, but also to make sure people understand their community, and that they have a way to follow it, and a way to get involved. I think personally that the complexity of how local public affairs works is a form of elitism. It's a form of, and it's not necessarily on purpose. It is just, you have to be elite and deeply involved to understand how budgets work, who's in charge. And we think of ourselves as kind of a key to that, a legend to help you follow what's happening in local politics and public affairs. So if you're interested in that, and if you support what we do, please go to voiceofsandiego.org, and you can check out our options to support us there. Thanks to Dr. Rebecca Fielding Miller for coming on. And if you have any more questions, let us know there, and we'll follow that thread. And thank you all for tuning in today. We'll talk to you on Wednesday. Oh, Wednesday, I believe I have Corey Briggs running for city attorney. Feisty and interesting man, and he'll have a lot to say then. So get your questions ready for Corey Briggs, who's running for San Diego city attorney. San Diego is one of the cities that has an elected city attorney who both prosecutes misdemeanors and serves as the lawyer for the city. So if you have any questions about that, let me know. Thank you all, and we'll talk to you Wednesday.